Well, when it comes to health care bills, millions of Americans may come up short, and it's only going to get worse as you age. So how do you reprioritize how you can stay healthy and wealthy as you get older? Dan Geltrude is an accounting professor and business and finance expert. He joins me now. Dan, how important is it to really focus on your retirement health care funds?
It's really important, and the time to start planning is today. If you haven't already started in the process, now's the time to do it. So what can you do to start preparing for health care costs in retirement? First of all, non-financial. Let's start to get a little healthier. How about some exercise? Get out there, move, watch what you eat. All the stuff we already know about, really important. The next thing, from a financial standpoint, there is a tool out there called an HSA, a health savings account. That allows you to put money away, similar to a 401k, where you can put money away tax-free for your costs later on for doctor bills and all those types of things. And as long as you're using them for medical costs, you get to take them out tax-free. Great way to save for future medical costs.
But that expires every year, right? You've got to use it within the year? Or
no, you get to hold on to it. Yes.
Hold, okay. When you also talk about saving money, I've got to put in for my kid's 529 plan. You know, where do I balance whether I should put money in for a health care fund long term or into a college fund for kids?
When it comes down to it, most people are automatically drawn to what cost am I going to have first? That's where I need to focus. So we think about saving for college, 529 plans as the priority. However, you will have a chance to be able to borrow if you need to for college costs. Down the road in retirement, when you need money for health care, there's no borrowing at that point. So it's a tough balance to strike, but if you have to pick one or the other, you got to save for retirement.
This is an interesting statistic. Fidelity Investments came out with a report that caught our eye. It said a 65-year-old couple will need $275,000 to cover health care costs. Why is it so high?
The number's staggering. So what that report said was, married couple, 65 years old, you will need $275,000 to last you just for health-related costs between retirement and death. Why does it cost so much? Well, to start with, Medicare Parts B and D are going to take up 35% of that number, paying those premiums. The other 65% related to out-of-pocket costs. You have your deductibles, you have co-pays, and all the other related costs for medical. On top of it, by the way, that does not include dental, and it doesn't include long-term care for when we're aging. So the number is staggering.
So if it's this high right now with this report, for folks that are younger, in 2-3 decades when we hit retirement, I mean, are we going to end up paying way more than our parents?
Of course we are. Of course we are. When you look at that number and where inflation is taking healthcare costs, it's going to be astronomical, because where CPI is, Consumer Price Index, going up each year, medical costs far exceeding that. So those future generations down the line, real issues.
So this is significant. I want to ask you, what are ways that we could cut down on the costs of healthcare?
First and foremost, how about taking better care of yourself? You know, when you're young and invincible, a lot of times we're letting those things go, but you got to eat right, you got to exercise, and you really have to be focused in on being healthy for the long term. As far as being able to save money just in general for when we're going to need these funds later on in life, we have to look at where we are today. Credit card bills, high interest, got to get rid of that. A terrible investment, new cars, find a reliable used one. Mortgage expense, always big. If you can strategically pay that down when you're younger, it's the best thing that you can do.
I thought that I was doing well saving for my kid's 529 plan. You've got me thinking about other things now. Dan Geltrude, thank you very much for joining us.
Thank you.
Yep.